All right. Hi there, does everybody see my PowerPoint full screen? Everybody hear me all right? Cool, I see some thumbs cheering me along. So welcome. Thank you all for taking the time to join us today for our Brown Bag Lunchtime virtual webinar for the TMC Library's McGovern Historical Center. My name is Matt Richardson. I am the archivist and special collections librarian, and I'll be speaking on the topic of the MHC and me, thinking about archives and legacies. So just to set the stage briefly before we get into it, I'll just speak a little bit to what an archives is. So archives are often situated in libraries, as ours is, but there are some fundamental differences in how we operate and how you can think about the collections. So some of the details you might be aware of or might need to learn are that we mostly have unpublished works like letters, diaries, photographs, committee minutes, that sort of thing. It's really about the raw firsthand information, those primary sources that people create in the course of their life and work. The researchers can then go back to learn more about how things went. It's less about the publications that may be available in journal articles or other places, and more about the behind the scenes process of how these things get made and how people did their work and lived their lives. Essentially, we're collecting evidence about the events and the people and how they came together. These can be the product of our daily activities. So you might think about something like the calendar you maintain that shows how you spent your time, who you interacted with, and when you were on vacation. They are typically going to be unique, one-of-a-kind materials, or at least not overly common materials. So we do have some things that would be technically published, like annual reports that, there's a few of them out there, but you can trust that the repository is going to maintain these in perpetuity, the way that somebody's closet or desk drawer might not. So as archivists, we do have a responsibility to acquire new collections. We preserve them to keep them in safe, climate-controlled facilities. We process them to make them available for the public, and we do outreach to make people aware that they exist and try to get people to engage with them and get in the door, because we're not just trying to keep all this stuff for ourselves. We want to have it here so that it can be used and be of service to the people that are in our constituencies. To speak a bit about the McGovern Historical Center briefly as a specific archive, I would just say that we are the archive of the TMC Library. If you're listening to this program, you are probably somehow involved in the Texas Medical Center or healthcare in Houston and Texas. And that means that we're the archive for you. So we have a lot of collections about the foundations and the development of the TMC, both the institutions like Herman Hospital or Texas Children's, or some of the UT schools, as well as the people that have worked in them, many physicians and nurses and other folks that have been part of the history of this area and this work. So we do exist to preserve and provide access to these collections of the TMC and the faculty and staff so that they can be used to benefit healthcare, health policy, research, and education throughout the world in alignment with the TMC library mission. We do have another webinar on our YouTube page where Sandra speaks in more detail about our archives as a general introduction. So I encourage you to check that out sometime if you haven't. All right, so what does archives get used for? What are the outputs? What are the uses? What are the reasons? Because again, we don't want this stuff for our own sake. We want it so people can use it. Well, there's a lot of different things that happen with archival materials. And I think one of the most exciting things about being around archives today is the variety of different things that can be done with them. We all have that image of the lone researcher working on the scholarly article, monograph, book, whatever it may be. And that certainly continues to happen. We do have a lot of works that are done that way, but there are also lots more modern, creative, different types of works getting done. So just to highlight a few, we'll have folks working on institutional histories within the TMC. It's the 50th anniversary, the 75th anniversary. They might reach out and say, what do you have about, our founding or our early days, or, we had a groundbreaking or a dedication in such and such years. We do have a lot of documentary films that come through. The screen has a picture of one Japanese public television documentary that used our atomic bomb collections recently. We also will have a lot of the public relations material similar to those institutional histories where they may be working with development officers or other parts of the institution to highlight all their great accomplishments, and as the place where those great accomplishments get preserved, and made accessible, people can come to us to use them for those things. There are also personal and family uses. You'll have genealogists come and looking for family histories, whether it's that their aunt was a nurse at such and such time at such and such hospital, or somebody has stories of genealogy that they're trying to dig through and piece together their family history. And really, there are all sorts of different things. So I've just highlighted a few of the ways that this all comes together. And you'll see I've got a book by Frederick Elliott about the birth of the Texas Medical Center, a recent article by Dr. Charles Balch at MD Anderson about recruiting Dr. Arlie Clark to start the MD Anderson Hospital, and then that Japanese public TV image there. And just to say, when I do have that picture of Dr. Balch's recent article, if you could just imagine trying to tell the history of MD Anderson Hospital without consulting the Arlie Clark papers or Dr. Bertner's papers, it's a bit of a thought exercise to just imagine how important this raw material is for the work that people then go out and do with it. All right, so this is my favorite slide, I'll admit. I enjoy putting this together. But yeah, so my premise here is, we've got all these things that the folks in our community, in our institutions are doing. If you're making cancer history, if you're leading medicine, if you're challenging convention, whatever it may be, we have all these bold statements of the contributions we're making and the impact we're making in the TMC and beyond. So if we take that premise, that the work you're doing is important, that it's impactful, we could even say it's historic, then it follows that future generations will have an interest in how that work got done. So the archives are a vehicle for preserving and making accessible that information for future generations. To put it another way, your work is making an impact today, and our work in the archives helps people remember that and learn how it happened. So to return to the archives and what we have here, I just wanted to highlight a few of the folks whose collections are already in the archives and sort of have you begin to visualize yourself, whether it's your own papers and your own research, or the institution where you work, or somebody that is a colleague or a contact that you may begin to think about, oh, their stuff is important, and I wonder what their plan is. I wonder if they are thinking about organizing it, ultimately having it deposited into an archive, if they think it's just for the rubbish heap, if they, how are they beginning to interact with it? As you envision either yourself or one of these other folks potentially being a donor for the archive, I just had this thought about Steve Martin's bit, from who knows this one, but he has this bit about how important names are and how important your command of the English language is. And essentially, if you want to start a bank, you have to call it something like First National Trust and Federal Reserve Securities Bank. You can't call it Fred's Bank because nobody wants to put their money there. Well, at the MHC, I assure you, any collections are in good company because we have papers from folks like Dr. Bertner, Dr. Cooley, Hildebrooke, John McGovern, and so on, as well as many of these institutional collections. So don't worry, I'm not pitching that anybody should go and give up their precious work and put it in Matt's Household Archives, but you can be confident that you're in good company if you begin to think about trusting your legacy and your papers to the Houston Academy of Medicine, Texas Medical Center Library, John P. McGovern Historical Collections and Research Center. All right, so again, thinking about understanding that the work you're doing or your departments or your institutions or your colleagues, your contacts are doing and needing to preserve it and take care of it, what do the archives offer? Why does it make sense to actually take advantage of the McGovern Historical Center, which I would frame for you as a service of the TMC library, just as you would use the TMC library for study space or for access to journal articles. Think about the archives as a service that you already have access to as a member of the TMC library and as a member of this community. What can it do for you, essentially? Well, we do have secure preservation storage, both in our physical space with climate-controlled facilities and security systems, as well as digitally with our server space and backups and our ability to transfer digital media in ways that verify its authenticity. We do have technical capabilities. I chose to show a picture of our digital forensic station here rather than just our physical space to highlight that we do have the ability to transfer things like floppy disks and DVDs and VHS tapes over to our preservation storage so that that stuff can be checked and understood and described and made accessible, and also so that we can create ways of verifying its authenticity at the point we get it off the digital media. To that end, we also do have professional knowledge and commitment with the folks that are on staff to keep up with best practices of the Society of American Archivists and others, and are doing everything we can to preserve and make accessible this material. We do focus on discovery and discoverability and promotion. I'm pleased to say that almost all the collections in the archives have some basic or more than basic record online. We call those finding aids, essentially expanded catalog records where they can be searched either in the general, here's the overview of the collection, or in many cases, a full inventory of the types of things that are in the collection. And we have that shared not only on our collection site, which launched in 2020, but also on the statewide aggregation portal, Texas Archival Resources Online. Beyond that, we also have a lot of digital resources, and we're adding more digital images in particular and videos regularly to what's available online beyond our reading room. And events like this, as well as exhibits and blog posts and other sources of promotion to let people know this stuff exists, because again, we want to have access for research. We have a place in our reading room as well as our remote reference services to get people connected to this stuff and able to use it. So you might be beginning to think, okay, well, maybe this person's archives would be something to preserve. Maybe the McGovern is a good place to do that. But what type of stuff do they want? Like, surely they don't want this. Surely they don't want that. Or, oh, this stuff's super important. I know they want it. Well, those are conversations that we're happy to have for anybody who is getting to this point in their own evaluation. There are a lot of different formats, so I wouldn't worry too much about the details of that. I would highlight that we're not just talking about paper, but photographs certainly, but also getting into audiovisual materials like VHS tapes, even older U-matic tapes in different formats, films, audio recordings. Really, there's no format limitations in terms of what could be potentially archival and of interest. Similar with digital media, we are always trying to expand our capabilities to handle all these weird formats that are becoming obsolete all the time. We are generally looking for things that we would say sort of broadly have enduring historical value. So these are the things that we could identify as being, evidentiary, being things that would be relevant for research in the future that people would want to look at and could learn something about how something happened. So, primary source materials, original documents whenever possible. You see here a typed letter with handwritten notes over it. Obviously, that continues to look different as we move more and more digital, but anything that shows how someone lived and how someone worked and how an institution did its work and how an institution thought about itself could tell a story in the future. Typically, these are going to be unpublished materials, less the reprints, less the journal articles, and more of the meeting minutes where stakeholders hashed out an important decision that got made later, or a letter behind the scenes when somebody's sort of working with their colleagues to describe a process. Typically, we're going to focus on aggregates. We'll think, a collection that has, 5 1-foot by 1-foot boxes or 50 1-foot by 1-foot boxes. Individual items are definitely interesting, but typically we're talking about like accumulating someone's work while they were in this position and all the things, all their office files or all of their personal papers in an aggregate. And something else that I would highlight as you're thinking about what type of material should go, we also do have the ability to look at restrictions, or have those conversations in terms of, oh, well, this stuff might have some sensitive information, some social security numbers, some bank account numbers, some patient information. And those are advantages of the archives as well, that we can have those conversations with you and try to hash out what types of protections can be put in place or what might not be appropriate for the archives and work through some of those details. And as you think about these questions, I would just encourage you to think that this isn't just a question for when someone's retiring and cleaning out their office. This is a question for every day when you're doing your work, or at least, from time to time as you're doing your work, to think about how you're creating the records, what your system is, if somebody else could walk in tomorrow and make sense of it, and do you have a plan for what's going to happen in the future? Do you want to start donating earlier? Do you want to start asking for advice on how you might organize your emails in a way that would be useful for somebody else later. The archives are happy to work with you to sort of make some of those plans, even if you're not ready to be at the point of donating. So obviously this all sounds great and you're totally sold and you know that you're super important and your work belongs in the archive. Or again, you know that, hey, I'm a part of this department or this organization. I wonder if we have a plan for this. Who should I talk to? Again, we're happy to have those conversations, whichever way they shake out. I tried to work this into an ABC kind of situation. It took a bit of a stretch, but you could ask and advise. So we just encourage you to reach out to the McGovern Historical Center. We can have the conversations about what you have, whether you were an appropriate fit or whether there might be a different repository. We can talk about some special considerations like restrictions or digital media that need to be dealt with. And we can sort of work through some of the initial considerations. Figure out how many boxes you're going to have and make a plan for sending them over if it comes together that readily. At that point, B would be boxing it up. And we can help you with that in terms of advice. Some things we would say if you're pulling out office files, you would want to keep them sort of in the sequence how you worked with them. We do want to try and maintain that original order as much as possible. And maybe if you have your office papers stop here and your personal papers stop here, you want to put in a divider to show that. If you have special formats, we can talk about different handling situations for those. So we can advise even on the process of boxing it up and not just clearing off your desk and dumping it in. So at that point, you'll create labels and we have a template we can share with you where essentially, if you can just write down box 1 of 4 has this, has such and such conference I was at, has this research project I was on, and they are from these dates, it gives us a real clear starting point for doing our description, our inventory to know what it is we're looking at. And then especially if you do that kind of work ahead of time, it makes it a lot easier when inevitably a few weeks later you say, oh my gosh, I think I sent this thing to the archives. Could you check and make sure it's there? I need to see it again. We're there for you, but if you can help us help you, that goes a long way. D is one of my easier letters. I get to say the deed of gift. So I have a little shot of that here in the program, but we do have a deed of gift, which is the agreement we would sign and you would sign in regards transferring different rights, retaining different rights, and how everything will be handled, what the expectations are of both the donor and the archives in terms of how the material will and won't be used. And we do have a standard version of that, but can also discuss details if you have particular concerns we need to work through. And that's the thing that sort of makes everything official. And then I had to stretch to get an E on this one instead of another D, but ensure delivery. So, pack it up, send it over, use FedEx, use UPS, whatever you need to do. Let us know it's on its way and we'll be on the lookout for it. If there are different considerations in terms of being in Houston and needing us on site, we can work out different details in terms of how things go. Again, just be in touch with us case by case and we'll figure out the best way to support you. All right, and then our goal, briefly stated, is to make materials accessible as possible, as soon as possible, while balancing preservation, staff time, and sensitive materials. So if you give us those inventories, that helps us out. If you let us know where there's some potentially restricted sensitive information, that helps us out. And the idea is to get a collection into the processing queue, which is essentially our plan for the work we're going to do. Create a collection level record where we say this is so-and-so's papers or records. It's about a paragraph summary of what's there. Here's the dates involved. It's X number of boxes. And then we can put that online so people know it exists and can begin to use it. We'll want to assess it for preservation, check to see if there's any mold or any bugs or anything that's snuck into your boxes. And I'm sure there won't be because you're so responsible, but we check. And then we might look into the prospect of reboxing if we need to transfer from, say, the third-hand Amazon boxes to the nice archival boxes. We can go ahead and do that. And then we'll be have it minimally accessible and continue to think about future preservation actions and future description, things like digitization down the line. And I should add at this point that if you are thinking about donating and you're in a position or your institution is in a position to support your collection with some sort of financial donation, that is certainly something that we are appreciative of and open to discussing. So there can be a lot of benefits to that because it is expensive to maintain the archives and to preserve them and to make them accessible. So it can help us do our operations generally, but also it can help speed things along in some cases. I'll just give a quick example where we had a film we were really keen on digitizing, a mental health video from the 50s about the services in Harris County. And the donor was agreed with us that it was important and was willing to help pay for the cost of digitization. And we were able to get that done quickly and get it posted online. So it does make a difference. And we are definitely grateful whenever that can help move things along. Other things would be to hire a project archivist or get paid interns to help with some of the work. And then there's always supplies. All right, and then I'm gonna move to wrap up here, and then I'll try to take some of y'all's questions. But just to tie it all together, as we do get things in, we have this mission statement that we preserve and provide access to the historical collections and rare materials of the TMC's institutions, faculty, and staff, which is what we've been discussing. But then there's the second half of this statement, which is so that the TMC institutions and others may benefit from the center's collections, contributing to healthcare, health policy, research, and education throughout the world. So it doesn't end with us putting it in a warehouse and calling it good. We are very much invested in getting the stuff to its audience and to its researchers so that new knowledge can be created. And again, this is where that idea of your legacy comes into play. If people are able to engage with your work and find new ways of discussing it and studying it and sharing it, that is the ultimate goal here. So just to highlight a few things we do, we have exhibits in the main TMC library. We have had classes in the archives in the past, and I'm sure we will again in the future. And we also have our reading room where you can come on site and do research. We are open by appointment currently. Just check out our website. And then also speaking about our website, we do have digital access modes. We are on social media. We have the Twitter and the Instagram and all those fun things. We have our collections site where, as I mentioned, our collections are almost all searchable by collection and sometimes in more detail with inventories. And then we also have our digital content, which continues to grow with more photographs, documents, and other things, audiovisual assets that you can search and use. So we are doing what we can to not only preserve the material, but to connect it to folks. And that is, as I said, what it's all about. So I appreciate you all taking the time. I encourage you all to go back to your own offices, your own institutions, and think about how this may apply and who else may be interested in having these conversations and may be appropriate for the archives to begin conversations with about archiving and making available their materials. And I thank you all for your time, and I'll wrap up there and take questions.
Matt, I have kind of a comment. I'm really fascinated by the fact of that the Japanese documentary used your archives. And I imagine that they have their own archives in their country. And I think it's pretty amazing that this event that was so horrible happened and the two countries between it happened are sharing the information about it this long after the fact. I think that's amazing.
Yeah, absolutely. And the ABCC, the Atomic Bomb Casualty Commission collections, for those who don't know, are one of our very prominent, I guess, collecting areas. And we have a lot of different individuals who were part of that organization. And then many of them came to work at the TMC, which is part of the collection, the connections. We collected those, have collected those for many years. And there's just incredible primary information here about this cross-cultural program and people's experiences. And it's a complicated thing, but it's a very fascinating thing for sure. And we always have folks interested in researching it.
I'm also, what would you like, if off the top of your head, what's one of your quirkiest collections?
Quirkiest?
Yeah. I'm putting you on the spot. I'm just curious.
No, sure. And I don't, I'll say something, but I'll, Sandra and Alethea are welcome to chime in. I have only been in this archive for about 7 months or so, 8 months, something like that. So I don't know everything and never will, but I think just our garment artifact and framed object section is the quirkiest section as a whole, because there are all these old, various degrees of effectiveness treatments and medical devices and doctors' things. So it's very distinct from a lot of other archives in terms of the variety of physical objects that have been created and used and marketed and collected over the years.
I was gonna say, we have one that was, Phil and I drove out to Austin to collect a collection of quack medical devices and early hearing aid kind of things like ear horns, and that was really weird. I mean, it's fun, but it's some weird stuff in there. It's very interesting, but the whole thing was just somebody's collection of stuff. So that's back there. That's pretty crazy.
Thanks, Alethea.
Kind of associated with the TMC, the Dr. Winerdy TMC memorabilia collection. It's stuff he got as head of the TMC, and it's a lot of kind of models and paperweights and stuff like that. It's interesting.
Cool.
Any other questions? I do have our contact info on the screen. Sandra Yates, our head of the McGovern, and my information is up there, as well as our general reference contact information, website, collection site, blog, all that good stuff. So definitely, follow up with us, check us out, reach out to us with questions or ideas for who else might be interested in learning more about the archives.